Welcome to a Gerontological Society of America Momentum discussion podcast, where we delve into topics that are generating great excitement and advancement in aging.
Welcome to today's podcast, The Second 50, Answers to the 7 Big Questions of Midlife and Beyond. My name is James Appleby. I'm CEO of the Gerontological Society of America, or GSA, and I'm pleased to serve as the host for today's podcast. GSA is the professional membership organization that represents the experts who study all aspects of aging across the life course. I'm delighted to be joined today by Dr. Debra Whitman, who is the AARP Chief Public Policy Officer and author of the book, The Second 50, Answers to the 7 Big Questions of Midlife and Beyond. Research shows that over the past 100 years, Americans have experienced a dramatic increase in their longevity. With the exciting possibilities and complex challenges this raises, we need a new roadmap for aging well. In The Second 50, Deb Whitman weaves moving personal stories from Americans across the country, together with the expertise of demographers, neuroscientists, and geriatricians, and her own personal experience of aging. She paints a compelling picture of aging in America today and what we need to do as individuals and a nation to ensure that all of us can age in better health and with financial security, dignity, and purpose. Deb, I've known you for many years and am delighted we are here today. You're a longtime member of GSA, and GSA has had a longstanding relationship with AARP, including featuring AARP experts and their new research insights in GSA publications and at our annual scientific meeting. You'll be talking more about your book and new research and policy developments for the 4,000 attendees of the GSA show. Before we jump into our conversation, I think our listeners would appreciate hearing about your tremendous experience in addressing aging issues. You're an economist and an expert on aging issues with experience in policymaking and research. And now, as AARP's Chief Public Policy Officer, you lead global policy and research to help communities, lawmakers, and the private sector improve our lives as we age. Previously, Deb served as staff director for the U.S. Senate Special Committee on Aging, where she worked across the aisle to increase retirement security, lower healthcare costs, protect vulnerable seniors, make the pharmaceutical industry more transparent, and improve our long-term care system. Deb is a writer and public speaker, a mom, and an advocate for those whose voices need to be heard. I so enjoyed reading The Second 50, Deb. I felt like I was having a one-on-one consultation with a trusted friend. It was just delightful. So to get us started, can you share with listeners what inspired you to author The Second 50, Answers to the 7 Big Questions of Midlife and Beyond?
Thanks, James, and thanks for having me today. I've always loved the GSA community, and I'm just delighted to be part of this podcast. So as you talked about in my bio, I've been working on aging for the last 25 years. And yet when I hit my own 50th birthday, I realized how little I actually knew about what to expect when I was aging. In fact, I looked at my bookshelf and there were so many books on what to expect when you're expecting, how to get your kids off to college. But I just couldn't find that resource that I needed that really talked about what aging is like in America today. And so I wrote down a list of questions and used that as the basis of the book, and then looked at research and experts and tried to tell stories both from my own life and my family. All of my family members hopefully are happy with how they were portrayed, and as well as people that I got to meet from across the country.
And you mentioned the 7 questions that the book is organized around. Can you share with listeners sort of why you took this approach and why these 7 questions?
So they were the questions that were most relevant to me. And I actually had a list of much more, but because of word count in the book, these were the 7, all that I could fit. And so I wanted to really think about things like our health and our longevity. So how long will I live and will I be healthy were sort of core to the book and where I get to kick it off. People's greatest fear is around cognitive decline and dementia. So I look at, will I lose my memory? People are also worried about practical things. How long are they going to work? And will their money last as long as they will? And then I looked at housing and long-term care and where will I live, and a little bit about the decision or the thing that's going to affect us all and how will I die. And then because of the work I do, I really also tried to have a section that talked about how we can make these things better for Americans so that we can all age easier.
Write quite a bit, Deb, about health and longevity in the second 50. What are some of the aspects of these two topics that may surprise readers?
Well, we assume that we live longer every year that went past. And we know that actually the trend in America, even before the pandemic, was that life expectancy was decreasing. So trying to get under that and explain the social drivers of health, I call them drivers. I know your audience is probably more used to determinants, but I felt like determinant sounded like something that real people couldn't make a difference in. And I learned, which isn't probably surprising to most people who is listening to this, that your zip code is more important than your genetic code. And we have huge differences in how long people live based on education and income. In fact, men at the highest 1% live 15 years longer than men at the lowest percent of income. And so I try to lay these out so people understand what affects their longevity, but also give them some hope. I share Dr. Becca Levy's work that your perception of aging, your internalized ageism or internalized joy of looking towards your future can make a 7-year difference in your life expectancy.
You talk in the book, of course, about Alzheimer's disease and dementia more broadly. And I was stunned by the research that shows that Americans fear the development of dementia more than the fear of cancer, stroke, and heart disease combined. What steps can listeners take, and all of us as individuals, to reduce the risk of developing dementia?
Well, we know that there's a whole array of healthy behaviors. This comes out of the Global Council on Brain Health work from my team at AARP, looking at things like how exercise, a good balanced diet, getting adequate sleep, and having good social relationships all can help lower our risk for cognitive decline and dementia. But we also encourage people to have a cognitive assessment, even just as a baseline, so that if they experience changes, they can check against that baseline. And then if they do feel like things are changing, to go and talk to their doctor to get evaluated. It's really important. We're learning more and more about the importance of early diagnosis so that people can make plans, set up a care network, help manage their financial resources. All of these things help with the early diagnosis.
It really, given the comprehensive impact of Alzheimer's disease and dementia on us all, it really is a public health issue, it seems. And I'm just wondering, what should we be demanding of our policymakers in terms of trying to address this issue in a systematic way that helps all of us as we age?
I think there's a lot of holes in our system that people with cognitive decline and dementia fall into. One's in our health system. And so the more we can encourage clinicians to look for those warning signs of cognitive decline and dementia and actually do evaluations so that people have that knowledge, that's really, really important. As you know, our healthcare system is also designed for acute illness. We don't really do well when people need social supports. Our long-term care system, unless you're on Medicaid, is really non-existent. And that's something that I talk about a lot in the book. And so we also need to make sure that we look at the racial and ethnic disparities and really target resources into Black communities where the rates are much higher and make sure that they have the tools that they need and the supports that they need.
You know, Deb, authoring a book like this is quite an undertaking, and I'm just wondering, throughout the process, did it result in a changing of your personal priorities? You know, has it changed what you really want to focus on in your own personal second 50?
It had in two ways. One, the information I'm trying to apply to myself, and also it helped me to understand where I had biases and misperceptions. I have to admit, there were several times when I was writing a chapter and I was talking to an expert like Diane Meyer, who is a palliative care genius. And I thought I knew to recommend to everybody that they should get an advance directive. And Diane shared with me the research is really lacking in that area. So I had a lot of aha moments, which, even working in this field for 20 years are kind of exciting to me when I learn something new. And throughout the whole thing I did, I also had new conversations with my family. And I, of course, interviewed them for lots of the chapters. And we talked about issues that I don't think we would have addressed had I not been writing the book.
We noted earlier that notwithstanding some of the challenges in recent years with increasing health life expectancy, that in general, over the past 100 years or so, we've had a dramatic increase in longevity. And while this is indeed a blessing, it also means, of course, there are plenty of challenges we've got to address as a society to ensure we can all thrive as we age. So what's your personal perspective after going through the process of writing this book and all the experiences you've had, your personal perspective on where we are as a society and agreeing on the areas where we can make improvements to help all of us age and on how to go about doing that?
Well, one thing that's important is that we're all aging from the moment we're born. And so there isn't a red state and a blue state difference in the fact that people don't age in one and do in another and don't care about the same issues. This is an issue. Aging is usually something that unites us all. Everything from the future of Social Security to the importance of Medicare, those are core issues. How we address them differs. And the role of government may differ based on your politics. But the one thing that I think I came to a conclusion was all of the issues that I talk about in each of the chapters, and this is the ending of the policy chapter, is there's no one thing that's going to fix all the problems we have, that we really need comprehensive solutions that look at the relationships, say, between housing and healthcare. If you don't have good housing, your health is going to decline. And so we need to think of these things in a cohesive way. And that's why I came to really try and promote a national plan for aging well in America. And we've seen many states and even cities and communities have strategies for aging. And right now, after I wrote the book, the administration is trying to put together a national plan as well. So it's exciting to me that action is happening and that when you look at a national plan, it addresses multiple sectors and multiple parts of government, as well as the private sector and communities. And this is what we're going to have to do in order to make it easier in America.
And that's where you get ready to close our podcast. It brings me to, I guess, a question, trying to get a sense of what your sort of perspective is on how able will our country be to help people navigate the second 50. Are you optimistic, pessimistic? How are you feeling about where we are now?
I tend to be an optimist, but also I like things done yesterday rather than tomorrow. So I'm a little bit frustrated. For example, I joined the Social Security Administration in 1997, thinking that we were going to make the program solvent in the next few years. And still now we're looking at 2034, the year I turned 64, actually. So there's so much that's happening, particularly at the state level, where we're seeing lots of engagement by the states on aging issues. I wish there was more at the federal level, but as an optimist, I will take every step forward that I can get and celebrate that.
Wonderful. Thank you, Deb. Thank you so much for being with us today. This has just been a wonderful podcast, and I'm so glad we were able to connect today and talk about your book. Your insights and observations are so incredibly important, and the way you've organized the book will make it easy for readers to be guided through practical steps that they can take to make their lives more meaningful as they age. Thank you also to those listening to our podcast. We hope you found it informative and enjoyable. This podcast received funding support from AARP. I encourage our listeners to check out other GSA Momentum discussion podcasts and webinars in our library on geron.org. That's geron.org.
Check out GSA Enrich at gsaenrich.geron.org, which is your gateway to a library of engaging learning resources. Access toolkits, courses, webinars, and more podcasts, all tailored to support your interest and advancement in the field of aging.